know a lot of people with school starting back and a lot of different things going on have had some things going on today, some scheduling issues today as well. So we wanted to go ahead and get started. Let's go ahead and just do some introductions. I know that it's harder to do it virtually, but I'll start and we can just kind of go around. My name is Amanda Engel-Linsky, and I work for the Coalition. I work on the Partnerships for Success grant and the Established Coalitions grant.
I'm Carly Crawford. I also work for Be Aware Blount, and I work on the Partnerships for Success grant.
I guess I'll go next. I'm James McMillan. I'm one of the 4-H agents here in Blount County.
I'm Amy Berger. I'm the other 4-H agent here in Blount County, and I work with the 4-H Health Rocks program, which is a typically hands-on interactive program designed to prevent substance abuse in young people and in adults. But we work with young people. That I'm guessing it's going to look really, really different this year, but I'm going to be very patient and do my best.
All right, who's next?
I know we just had Jan and Will join.
We're just doing introductions.
I don't mind to go ahead and jump on. I don't know if you can see me or not, but okay. I'm Debbie Schuyler. I'm the Family Resource Director with Maryville City Schools. And yes, we have started back and it's been a little hectic, but so glad to be here at the meeting today.
Hey, it's Will Gates, health educator for Blount County Health Department, but have been transitioned over the past several months to COVID case investigator.
Thanks for being here.
All right. Was that everyone?
Is there
Jan.
Oh yeah,
Jan hasn't gone.
Maybe Jan's.
Maybe she's not able to, maybe her mic isn't working. That's okay. We can go ahead and get started then. All right.
So today what we really wanted to focus on is to give everyone an update on the events that we have coming up. Just like what Amy was saying, our events are going to be looking different this year probably than what they normally would. So we're really trying as best we can to keep up with the reach that we would normally have while making modifications that keeps everyone in our county safe and keeps people as comfortable as we can, basically, while still doing our thing. So the first event that we wanted to talk about today is our Take Back Blount event. For you guys that were with us last year, it's held on August 31st. Last year was the first year that we held an event. And it really focuses on International Overdose Awareness Day. And that's on the 31st, which is why we're doing this event on a Monday. So last year we had it at Smithview Pavilion, and we had it as an open fair. We had tables set up. This year it's going to be a similar concept, but we're doing a drive-thru event instead. So as opposed to getting out of your car and this being something that you would stay at for a bit, we're going to do a drive-thru, and we're going to be handing out medication lockboxes for free. So if you don't have a medication lockbox, please stop by. We can get you one of those. We're going to be handing out free medication disposal packets, and those are packets that when you add those to your prescription bottles with some water, those actually dissolve your medications down to a point where you can safely dispose of them. And we're doing that because we know that for some people it's difficult to get out and to go to the Justice Center and to dump your meds or dispose of your meds like you normally would. So that's something that we're trying to do this time as well. And then the last thing is that we're going to have Narcan available. So if you don't have Narcan, or if you've never been to a Narcan training, we're going to do some modifications. You'll be able to stay in your car. But Marissa Valentine is our rope specialist, our regional overdose prevention specialist, and she'll be there to do a modified training and also hand out Narcan to anyone that might need it. So that's kind of the resource component of it. And then we're also going to have a candlelight display similar to what we had last year that's remembering those in our county that have been lost to drug overdose. And that'll be something that can be observed again from your car. So you're not having to get out or worry about, that public health piece of it. So that'll be again, August 31st from 6 to 8 at Smithview Pavilion. Does anyone have any questions on that or comments?
I have a couple of questions. Amy and I, with the audience we're working with, we could hand out some of those disposable packets if that would be available. And do you need any help on the 31st?
We can absolutely, if you talk with us a little bit more about when you would be planning on handing those out, we could definitely get you some of those for the events and for the populations that you're working with. And then we could absolutely use help on the 31st. We have a couple individuals that are planning on coming, but we sort of don't know what to expect since this is the first time we're doing a drive-through. So any help at all would be great.
Where would we meet you and when and stuff like that? You can send it to me later.
Okay, yeah, if anyone's interested in actually volunteering on the 31st, that would be fantastic. If you want to reach out to me, you can reach out to us directly after the meeting through email if you want, or even through Facebook Messenger. If you follow our agency, our group on Facebook, we are pretty good about getting back to those messages as well. And so we can get anyone's specifics on time and place that would like to help out with that event. So thank you. Anybody else have any questions or thoughts on this particular event? All right.
Okay. So next we wanted to talk about this statewide campaign that's launching next week in honor of International Overdose Awareness Day. So it's called the Every Word Matters campaign, and basically this is just intending to help reduce stigma. It's basically saying that every word matters when you're talking about issues like addiction, and words can really hurt when you're trying to overcome something like addiction. And so next Monday is when we will start posting about this. There's a pledge that is associated with it, and it's essentially saying that you're not going to use certain words that are derogatory and things like that. And so we would love it if everyone would participate in that by sharing, taking the pledge, and just posting about it on your social media in general. Also, this is a great opportunity to just have those conversations in real life. And so, yes, basically it's just launching some stigma reduction messaging right before we go into our International Overdose Awareness Day.
And if you know, or if you work with a population that is struggling with addiction or has substance misuse issues, of course, that stigma that's associated with the addiction itself is such a huge piece of what there is to overcome, even outside of, a physical addiction. So that's the whole point in this campaign. It was really launched by the state. If you haven't already said that, the Department of Mental Health and Substance Abuse Services has helped launch this campaign, and they'd love for every county that's doing an International Overdose Awareness Day event to kind of kick that off on Monday, the Monday before, to have people thinking about that piece, the stigma reduction piece of it as we go into that. Any thoughts or questions on that? We'll be sending out media messaging that you can share in your social media platforms and also through email. But any other thoughts or questions on this particular campaign?
Amanda, will you also be sending the same type of thing for your Take Back Blount?
Yes.
I'll be sending a follow-up email,
Okay.
and it'll have links to everything that we talk about today.
Everything we talked about. Okay, so both of these. Okay, perfect.
I meant to say also, we're having a couple of flyers printed for the Take Back Blount event. And so if you're interested in passing out flyers, if you think that an in-person flyer would be helpful for you, just let us know and we will get those to you.
And you can just email us if you need those or anything like that.
Mm-hmm. Okay.
All right. Okay. So, as some of you may know, the Rebel Run 5 and 10K is happening this weekend on Saturday. It's a fundraiser for the Maryville City Schools Foundation, and it's an event this year that we've decided to sponsor. So, as a sponsor, we saw this as an opportunity for some awareness for us and for some media and messaging with a broader scope audience than what we would normally hit. And so there are two options for this. You can sign up in person or you can sign up virtually. They're anticipating a fairly big turnout in person for this event, for the race. But you can also do a virtual race on your own and post your results. Definitely take a look for our logo. It should be at every mile marker, along with some of information about our coalition. The bags that are being distributed to each participant has our information in it. We have information on prescription drug abuse, and then also on vaping and e-cigarettes. We felt like those would be two topics that would be good for individuals that are going through the race. And then we have a big media campaign that Maryville City Schools Foundation is pushing out on our behalf, which is nice. And so basically, when individuals finish the race, there's going to be a photo frame that they can physically hold and have their picture taken, and using the hashtag race to prevention. So when they use that hashtag, we'll be able to essentially find every individual at the end of the race that has participated under that hashtag. And we're hoping to kind of make that an awareness piece on our end as well. But they've been encouraged to, what am I forgetting? To tag our coalition on social media platforms, and what else?
I think it was mostly just tagging us with your results if you're doing the virtual, and then the photo frame with our hashtag if you're doing it in person.
Yes. So that'll be this Saturday. We will be getting some photos. We'll be at the event briefly, but they really aren't having just tons of volunteers this year working that event. So if anyone's participating in it, definitely take pictures, send them to us, let us know how it goes. And hopefully that'll be something that is a big awareness piece for us.
Yes. Does anyone have any questions about that? All right. Do you want to talk about this?
Yes. Okay. So we talked about the young adult survey, and we're finally in the final countdown of this. This will be going on for another week until the end, well, another like week and a half until the end of the month. They've extended it, but this is the Tennessee Young Adult Survey. It's hosted by the Tennessee Department of Mental Health and Substance Abuse Services. It's an online survey for individuals 18 to 25 years old that are living in Tennessee. It's super important that they complete this. For some reason, this age demographic has been kind of hard to reach in our county, but we've just recently posted information in person and online at Maryville College. And so with college students coming back on campus this week and last week, we're really hoping that we're going to drum up more participation, but it's county-specific data that we get when these individuals take this survey, and we get it from the state, and it actually helps the state and the federal government when they're looking across the state to determine what areas of need we have when it comes to funding or new opportunities that may come up. So if you don't fall into this age range, like I don't fall into this age range, if you can please go ahead and just share it on your social media, okay? The QSR code right there, you just have to scan it and it'll pull up on your phone, and you can take the survey and complete that really quickly. So just getting it out there, continuing to share it, get it into other spheres of influence in our county, that's super helpful for us as well. And we also have, if you're looking for physical flyers, we still have a few of those left as well, if you think that that would be helpful for you or your agency. Does anyone have any thoughts or questions on that? Okay, so that'll be going on until the 31st.
All right, so we are about to send out some membership MoAs. So basically, in these COVID times, we're going to be using our MoAs this year as a way to track our active participants in the coalition. We were going to send these out last month, and then we're essentially just going to redo it because there's some old information and we want to make sure that everything's up to date and right. So we will be sending those out probably this week or next week. And if you're interested in maintaining active membership with our coalition, then please fill that out and send that back to one of us. If you need it in like a fillable PDF form, please let me know and I can definitely send that to you in that format, or just any format would be great. So if you have any questions about what that'll look like, let me know. And otherwise, just be looking for that in your email. Is there anything you want to add about that?
No, it's just an important piece of documentation that our grants require that we have. Outside of it just being a good tool to talk about expectations with our members with, and kind of what our goals are, it is something that in our contracts we are required to do and to renew each year. Okay, so today, in lieu of articles that we would read off, we really just wanted to offer you all some digital prevention resources. Since so many people are at home, they're with their kids at home, we're still doing a lot of virtual learning, and so we thought this would be a great way if you have kids at home and you're trying to kind of figure out what you need to do. Then these are some easy apps and online services that you can access. So the first one that we have is the Sesame Street webinar series, and this is for parents, but it's basically how parental addiction affects young children and the impact that children experience from their parents struggling with substance misuse issues. So that is, like I said, a series. You can watch it. We'll have the link posted where you can access it really easily. But that's the first one we wanted to talk about. There's an app right now called Alcohol FX app. There are some caveats with this. We've tried it out. It only works on tablets, so you can't access it from a phone. And there's some issues with the screen size, but it walks through specific parts of the brain and brain chemistry and how the brain is affected when individuals are using alcohol, specifically young folks. And so if you're at home, if you have kids at home, you're trying to fill some time, but you still want them to do something educational, this is a good app for that because it's interactive and it's all educational on the effects of alcohol on the brain. We've got the, from SAMHSA, we've got a marijuana quiz. So this is great for parents. I'll tell you, I took the quiz because I have school-age children and I didn't pass all the questions. It's a lot of questions on really current information. SAMHSA has partnered with young folks to create this quiz. So if you're a parent of school-age children, I would strongly encourage you to take this quiz. We'll have the link for you as well. But it's just good to know. It's great to know if you have things that you need to be looking for in your own home. And when your children are talking, when you're monitoring their phone calls or their text messages or whatever, it's good to have that information. And so I would strongly recommend that you take the marijuana quiz. And that's a website that you can go to. The SOS Substance Abuse Prevention app. That is an app for prevention efforts community-wide. So if you're just interested in thinking of new ways that you could have community impact or resources for communities, there's a good app for that. And most of these are good for both Android and iPhone or Apple. All of them will work on Apple devices. And then these last two that we have here, if you've been with us for any length of time at all, SBIRT is an initiative that was launched through SAMHSA as well. So this is for professionals. It's the screening, brief intervention, and referral to treatment model, okay? So if you've been through it before, you're already very familiar, but basically it is an app that you can use. You can download it on your phone, and if you're a professional that's working in any capacity with individuals that may struggle with substance misuse issues, it's great to have because it will walk you step by step on what to do if you encounter someone that you think needs help. And so if you can't go through the full training, it's good to have that app on your phone because you can just have it at the ready, you can pull it up and it'll kind of walk you through exactly what you need to do. If you've ever worked in a field where maybe you're encountering individuals in the public that are struggling with substance issues, then you know it can feel very jarring if you don't know what to do, or you don't exactly know what you need to do. Anyways, that's a great thing to have, and it doesn't have to be just mental health folks or just healthcare folks. Anybody that's working with the general public that may come in contact with individuals that are struggling, it's a great app to just have on your phone. The last one I'm going to mention is Quick Start, and it's from the CDC. It's a smoking cessation app. And so we wanted to talk about that for just a second, because actually we know that right now with COVID and smoking, those two things are kind of indirectly linked as far as not being good for one another. So if you're at home and you want to stop smoking, or if you know someone that wants to stop smoking and they can't attend a group, or they can't go through a cessation class, this app is great because it will track things like how many days you've been without a cigarette or tobacco. It'll track things like what your personal progress is. It'll give you can win awards by doing that. It'll link you to virtual resources and individuals that are also doing the same thing. So if you know someone that is ready to stop smoking or wants to maintain their smoking cessation in this time when a lot of groups still kind of aren't meeting, this is a good option for that. And we wanted to include that. So I think that was all of the virtual resources. We are going to update these resources onto our website. And so if you've been to our website, you can take a look at those. And we're going to have a new section, especially with the way that things are changing in our community. We're going to have a section specifically for virtual resources. So as you guys are working in your communities, if you need to connect someone, or if you want to connect with resources, but you're not able to do it in person, there'll be options for that. And so that's kind of what we've been leaning into with that.
And on our website, there are already some virtual resources, so definitely check those out if you're interested, or if you know someone that might need it. There are already some on there.
Right. Any thoughts on that, or does anyone have a resource they want to add? This certainly isn't a comprehensive list, but we wanted to give you a variety of options. All right. Okay.
I think this is great, guys. Thank you.
Of course.
Oh, you're welcome.
All right. And then lastly, we wanted to just give you some media updates on some stuff that we've been working on. And so we were fortunate enough to secure another billboard location on the way to Townsend, and it has our drug drop box information on it, which is great because we can reach an audience that sometimes we might not already be able to. And so hopefully a lot of people will be more aware that these resources are available to them. So if you see that, definitely let us know. We already have two. One is off of Calderwood, close to the public library, and then one is in Greenback, I believe.
Off of 411.
Yes, off of 411. And so, yeah, if you see any of our billboards, let us know, because we're pretty excited about that, since billboard real estate is kind of hard to come by in Blount County. We also have just launched our opioid commercial again. So that is running on all of Comcast networks, yes, which includes the streaming services that they offer for like internet apps and stuff like that. So we're pretty excited about that as well. And then lastly, we are starting a podcast. So yay. This will be a little bit of a learning curve, I think, for us, but we're very excited to have sort of an open dialogue about all things substance misuse related and all of the tangents that are related. We're hoping to talk to people, hear their stories, share current information, and much more. So hopefully within the next month, we will have an episode recorded and put together, and we'll start releasing those as soon as we have them.
And I'm just kind of blindly optimistic about it, because I'm super excited about, like, a podcast is just a great option for awareness and stigma reduction, especially since we want to tell these stories and people are listening to tons of podcasts right now. So this is a great opportunity. So I'm just like blindly optimistic. Carly is the person that actually has to do our media and edit and record and all of that. And so I think she has a little more anxiety about it, but we really, I'm pumped about it. Ashley Krause is going to be our first interview to tell her story about addiction to recovery and how she's a peer navigator now. We have just kind of our initial sketches that we've done on this is we want to do a segment on vape culture and interview teens on that and kind of how that affects so many different things. We want to do an episode for an individual that has grown up in a home with substance misuse issues or has had parents with substance misuse issues. We'd love to cover an episode on what losing a loved one to overdose is like and the impact there. And then, just all the tertiary ways that substance abuse affects so many different things in our lives and our community. But our whole theme and goal is to just kind of have a really non-judgmental platform for people to hear stories and to connect it to the part of no one's exempt from it. It happens, and these are how people have dealt with it and learned to continue living their lives. So we also feel like this would be a nice way to reach youth because our youth like podcasts and they listen to podcasts. So as we have more information, like I said, we have some pie in the sky ideas right now, but I feel like that's a good place to start. And so as we get more information, we'll have like a launch schedule in a way for you all to follow and to listen in and give us feedback. So yeah. Do you guys have any thoughts on that or anything? If you've done podcasts yourself before, any ideas there?
Or just any topics that you would want to hear about?
Yeah.
Amanda, can I jump in here?
Yeah.
Okay. Having freshly come off of a webinar yesterday on implicit bias, I think it might be wonderful if you could do one on implicit bias towards drug addiction.
Hey, that would
And
be great.
the gentleman that is doing the workshops, there are 3 on implicit bias, is out of Nashville, and I can get you his name, but I thought it was very interesting. He said, what do you think of when you think of Black males in an urban community that drive an expensive car and have a lot of cell phones? And everyone immediately said drug dealer.
Right.
And he said, yes. How many of you said doctor?
Right.
And there was a pause, and he said, go ahead and drive expensive cars, have lots of phone, and be a doctor. How many people thought of that? And it was just very interesting to hear his take on the biases that come with it. But it wasn't just for that, but it made me think of you all and how it would be great to do something on implicit bias towards drug addiction.
Yeah, and that's another thing too. It doesn't necessarily just have to be stories of people that have had personal experiences. We would love to talk to professionals to lend that side of it as well. Professionals that are actively working to change stigma or to change bias, or that are trying to connect people to resources, or that have experiences with how very difficult it is if someone doesn't have money or insurance to get into treatment.
Right.
All of those pieces.
Right.
So yeah,
I'll try and get you his contact information. I think he'd be really good.
That would be great.
Also, can I go ahead and plug the RFD TV program called Crossings? It's run by Howard Buffett, who's Warren Buffett's son. But RFD did a special on it about drug addiction in our country, in rural America, and what they're doing to take care of this. And it looked at a program that Mr. Buffett gave millions of dollars towards, and it is in Illinois, in a very rural area. But it was an excellent program to watch and to see the struggles that they have gone through. I highly recommend it. I don't know when it will be back on RFD TV, but if you do get that channel and you can find Crossings, it is well worth watching.
I think we can find it on YouTube.
Probably.
Yeah, we may be able to find the link online that we could send out.
All right. And now I'll be quiet.
No, thank you. That's a great segue. Does anyone have any updates for their agencies or their lives?
Hey guys, I'm Davis. I'm with MDC in Knoxville, and we are doing a every 2 week kind of a reassessment about working from home or being in the office and doing everything virtually, or actually being able to get out and see people in person. Why I haven't met you guys yet because we're still working from home. That'll be reassessed come, I guess, a week from today. But we're really having some struggles trying to continue our youth initiatives and mental health first aid. Courtney is she's still doing her forums and her trainings, but the participation is severely limited or really very diminished. I personally am struggling with referrals, trying to help people find inpatient help and outpatient help. I mean, the seats, the beds are all diminished just terribly. And, it's crazy because we have times such as these, nobody knows how to deal. It's brand new to everybody. So there's not a book or a standard or a format or protocol, as you all, I'm sure, are all well aware. And so the bed capacity is diminished, but the need is greater because you have all these addicts and alcoholics that are out of work or, sitting at home. And then, the government gives them, more money than a lot of them have ever had, in one lump sum. And so anyway, I know here in Knoxville, in the surrounding areas, Blount County, Maryville, I see the same thing in Roane County, Loudon, all the way up to Tazewell and Scott and Campbell. The need is just so great and so much, I guess it's relative, but so much greater, now than it has been. And so that's a little picture of what we have going on here in Knoxville, what MDC is doing and trying to do and not able to do, and fill in the blank. But yeah, that's where we're at.
I think we're all kind of trying to reassess what, especially if you're in primary, any kind of primary prevention, but tertiary prevention too, or secondary prevention is just as much of a struggle. One thing that we're looking into for the fall, because we are concerned that Red Ribbon Week is going to look very different. Not concerned. We're trying to just kind of anticipate that Red Ribbon Week, which is a major youth event for us, is going to look very differently this year. But we're trying to capitalize on some of that virtual learning piece of it and maybe doing Zoom sessions for schools if we can't be in there, and perhaps that our reach would be even broader with that because it's a lot easier for a teacher to click on a Zoom link as opposed to having students come to an assembly and do all that part of it. So it is difficult, especially when you're trying to figure out, like what you were saying, referrals and things like that. But we are trying to just sort of make the most of the virtual piece of it as we can for the moment, and not let our impact just totally dwindle because of it. But you're right, it is hard, and I think anybody that's working on any projects in the public right now could probably say the same thing, even our school systems.
Right. So tell me, are you Carly?
Yes. Well, I'm Carly.
She's who? I'm sorry, I didn't hear you.
Amanda.
That's me.
Miranda. Okay, great. I'm glad to meet you guys. So tell me, insofar as your youth initiative is concerned, or, reaching and working with the youth in the schools, are you able to kind of piggyback the virtual learning that they're using in the Blount County schools?
That's what our hope is. I will say right now, and Deb can probably speak some to this, the virtual learning and in-person learning is kind of changing and being reassessed weekly in our 3 districts right now. And so we are trying to let things settle down for schools a little bit before adding in a lot of different parts or
extracurriculars,
right, things that might be asking more of them. But that's what we're thinking as far as like for curriculum, for in-school curriculum, trying to offer virtual classes that we could zoom in the classroom and do that, because we are anticipating that our school systems are not going to be allowing a lot of community partners in to the school in-person learning. So yeah, so that's something that we're definitely looking at right now. I don't have tons of just really clear-cut information on that yet, because like I said, our schools have gone back at different times as well, all 3 districts, and at different kind of capacities. So we are trying to let them get a handle on that a little bit more before trying to add more to that. But I think that is the direction that we'll be leaning in, and recording things on YouTube that teachers can access kind of at will. So they don't have to, they can do that as it's convenient for them, or even make that as additional assignments outside of the classroom.
Right. That's actually been something that some of our projects have kind of been relegated to, is recording.
Yes.
And a readily accessible recording, instead, because of the lack of active involvement or participation.
Right.
That's something it's kind of short-lived, or so far it's, we've not had enough time to see how much involvement takes place, or how easy or how actively people are pursuing using that resource, but it's something that we're going after. Last question I have about the youth stuff: what type of involvement have you guys had in the past? Like, numbers wise, have you guys had quite a bit of youth involvement? And if so, how have you gotten them interested? How have you gotten them involved?
Well, so it kind of depends on what you're talking about. If you're talking about youth coalitions, that's a fairly new initiative for us. And so we've got a lot of progress there, but we don't have the same kind of numbers that some of your more established counties that have had youth coalitions for many years do. If you're just talking about educational initiatives or awareness initiatives, we've had a pretty decent turnout. We have Red Ribbon Week is a big one for us, and that's a campaign week where we do anti-drug, alcohol, tobacco, and bullying education. And we have certain schools that have let us come in and do presentations for the entire school for that. So last year, we had really high numbers for that. And as Will mentioned, we also have tobacco tales. And so last year, the impact for that was really huge. Will Gates from the health department was able to coordinate with almost every single after-school program, if not every after-school program. And then this year, we are actually looking to get into our elementary schools for Alcoa City schools, assuming that we can do that, and doing some school time education as well. And so I wish I had those numbers right off the top of my head to pull. I'm just like,
no, it's fine. I didn't mean to. I'm not trying to, put you on the spot. I just am curious, because we haven't had. I know Sarah Sandlin is with MDC, is the MDC youth coordinator, youth coalition coordinator.
Yeah.
And I think she and we as a collective have just struggled trying to, get the, there's just like a select few, that are there perennially, that want to be involved, that have had some really direct trauma and some, indirect experiences with the issues at hand, and want to be the cause of rehabilitation or prevention, not rehabilitation, but to prevent their friends and families from going through what they've already been through. Those numbers are very few, right? Like and we are trying to figure out how, to make it more, how do you, is that right? Do you want to make it more interesting? I mean, how do you pull young people in?
One thing that we're doing as soon as we do it, so I know that there's like a caveat with everything right now, but like as soon as we're able to do in-person education, we have just set up a partnership with our Boys and Girls Club. And so our shift in the age range that we were originally looking at is down some. So instead of it just being high school or coalitions, we're looking now into 5th through 7th grade coalitions, because these kids, we found at least, kind of very much want to identify with a group. They don't really care what the group is, but we've gotten a lot of feedback from the kids that we've already worked with that they want to do some good, and they're just kind of waiting for an adult or a peer to point them in that direction. And so we've had some super positive
wow.
our 5th through 7th graders,
Mhm.
and they've been very sort of just open and malleable to the message. And so that's our hope with working with Boys and Girls Club, is that, first of all, it'll kind of be mandatory, like it'll be part of their curriculum to attend those meetings, and then within that, to develop some leadership skills with kids that are particularly interested in the topic. So we are trying to do sort of like a culture shift with that age group of, it is cool to care, and it's cool to be involved, and it's, a good thing to have like positive behavior and to take care of yourself and be healthy. That's the shift I think that we're looking for by targeting some younger kids.
Another piece of it, if you're just simply talking about meeting kids where they are, they're on TikTok.
Yeah.
So
right.
There's a ton of TikTok trends, as I'm sure everyone knows. And so it's been recommended to us, and we've been looking into.
Because those were some really positive
Yeah.
TikTok trends as well. So almost like counter messaging, all of these kids are vaping. Well, guess what? All of these kids aren't vaping. So
The majority.
yeah, trying to really tap into how many of their peers are actually making great decisions all the time. So I feel like that was a really long answer. And if you want to talk more one-on-one, set up a meeting for sure.
Yeah, it is. And that's not even really my area. It's just a coworker and a dear friend that I really see struggling, and just want, to give her information or some, pass along some knowledge. I'm sure I definitely want to talk with you two separately, and probably a lot of the people on this Zoom call. But yeah, we can pursue that further at a later date.
Yeah, email us anytime and we can set up a meeting.
Do that.
I did email you, Carly, earlier this morning, I think. And if you didn't get that, let me know, because I might have sent it to the wrong. I clicked the link at the bottom of the flyer in the email. So
I don't think I received that, but
okay. I'll figure it out.
Okay.
Well, tell me your email real quick.
It's Carly, CARLY, at beawareblunt.org.
Is that all spelled out, like BEAWARE?
Mm-hmm.
Okay. All right. Thanks.
Thank you.
Of course. Yeah, thank you.
All right. Any other updates out there? Things to think about or to know about?
I've got one. I hope it's okay. First off, let me apologize for my, I'm really tardy, so I apologize. Shannon, I work for Helen Ross McNabb Center, and Shannon's off today, and she sent me the link and was like, better late than never. So here I am. I do apologize, though. I typically am not a late type of person. Hey, I wanted to share with you guys that Helen Ross has been chosen as the host for CCP, which is a crisis counseling program, and it is a funding comes from FEMA and the Tennessee Recovery Project, and I'm all over the place, sorry. But anyway, so Blount County has been identified as a disaster area, unfortunately, when it comes to COVID-19. And so this county has been identified as needing some assistance. So what this is it's a phone that we have. It's all over the phone for obvious reasons. And it's Monday through Friday, 8 to 5. And we're just here to help people through this difficult time who are experiencing, it can be a crisis. It can be really they just need resources. It doesn't have to be super serious. It can be any questions regarding their experience, but it can also be a crisis where they're just struggling to deal. Maybe they've lost their job, or they're just affected by what's going on with the virus. It's for everybody. It's for teachers, it's for nurses, it's for the people we serve in the community, it's for people who work in social service agencies. It's open to anybody. There's no insurance involvement. So if anyone's interested in getting like rack cards, brochures, or a flyer to print off, I'm going to throw my email in the chat box and my number. Please feel free to email me directly, and I will get you what you need. It's a great resource for our clients in the community. So I appreciate you letting me arrive late and then let me make an announcement. Thank you.
Good. We'll post it on our social media platforms as well.
Awesome. I appreciate y'all. Thanks so much. And I'm the services coordinator at the Helen Ross McNabb Center here in Blount County.
Great.
Thanks.
Thank you.
Thanks for sharing.
Appreciate it.
Anything else as we are wrapping up? Any final thoughts or announcements? All right. Well, I think then that's a wrap for today. We will keep you posted. We hope to see all of you either in the drive-thru line or in person on August the 31st at our Take Back Blount event. And if you are interested in volunteering or helping out with that, please just reach out to us directly and we'll get you some specifics on that. But otherwise, we hope to see you guys in the drive-thru August 31st, 6 to 8 p.m., Smithview Pavilion. So otherwise, you guys take care, stay well out there, and hopefully we will be seeing you all soon. Bye.
Bye.